Care coordination presentation to colleagues. Hi, I am Vanessa. I have practiced as a health professional for about a decade now. I was tasked with an obligation to give insights into the essence of care coordination. Throughout my exhibition, I will define what care coordination is and its impact in the healthcare process, and how nurses can apply ethical principles to promote better healthcare outcomes. As nurses, we are obliged to foster care coordination to facilitate healthcare services. We are all expected to provide patient and family-centered and group-based care tailored to evaluate and enhance the patient's dynamics, needs, while simultaneously helping patients navigate the healthcare system effectively. Care coordination. Care coordination refers to processes and activities that ensures that the patient's dynamic needs and inclinations for healthcare services and data sharing are enhanced effectively across the board. Numerous families, patients, and informal health professionals have at one time experienced fiascos in implementing care coordination in the healthcare setting. Kowalkowski, 2019. Importance of care coordination. Essentially, care coordination promotes patient satisfaction of care and strives to minimize the healthcare-related costs and improve the health results simultaneously. Many healthcare organizations are undergoing a robust transformation to reform their activities, entailing a shift to value-based repayment approach that compensates healthcare professionals for adequately managing people's health. To fully address the emotional health of people, adherence to care coordination is much needed. While managing care coordination requires proper and sound communication among the team members' healthcare professionals. It also involves offering patient education at all levels appropriately and conveniently. Care coordination also entails establishing plans that provide medical attention to the patient's unique conditions and uncover obstacles that may avert them from conforming to the care plan. Proper coordination matters not only on a larger scale because it is essential to attain the reforms that all people eligible to the healthcare system require, Miller, 2019. Through effective care coordination, trust is established between the patients and the nurses or healthcare professionals. Therefore, the caregivers are empowered and motivated to contribute the success of healthcare outcome. Procedures for care coordination. A proper nursing process is used to synchronize plans for routine activities. The nursing course considers a collaborative and personal model with problem-solving and decision-making process that acts as a basis for the provision of nursing care. It encompasses gathering data, uncovering the patient's needs, identifying the objectives with significant and quantifiable results, and adopting personalized nursing treatment models to help the patients attain the intended purposes for workable products. Kowalkowski, 2019. In addition to collaborative care constitutes of the whole teams and proper care coordination. Who constitutes the care team? The care team consists of physicians, nurses, dietitians, social workers, caseworkers, therapists, care techs, and pharmacists, among other people who can work together with the patient on the patient's healing process. Miller, 2019, identifies the key elements of care coordination as good communication and operative care plan transition among the providers, precise and straightforward data understood by the patients, a specific focus on the aggregate healthcare prerequisites of the patients, easy admission to a wide range of healthcare services and healthcare professionals. Types of care coordination. The first care coordination is primary care coordination. It entails offering care and preventive health for the patients associated with acute conditions and issues. Johns Hopkins University points the guided care model to address the ever-present hurdle of handling and managing the aging people in the U.S. When all the professionals effectively use the model, as mentioned above, patients, healthcare professionals should jointly coordinate to offer sufficient care that is a patient-centered approach. The second step of care coordination is acute care coordination, which puts into the patients with severe healthcare problems. For instance, a heart attack, obesity, and stroke. Such patients should be subjected to emergency care services. With deprived communication systems, cases of medication errors and severances compromises with the healthcare system. When the healthcare professionals foster proper communication amongst themselves, healthcare outcomes are highly improved. In such a care coordination system, the transition of care programs that consider the treatments, follow-up appointments, and proper drug prescription are disseminated and documented as an ideal pharmacy. Miller, 2019. An appropriate way of giving instructions is giving to the patients and the health professionals providing the care and the family members. The most outstanding goal is to ensure effective transitions of the care programs to minimize extreme cases of increased hospitals' readmission rates, among many other issues. The third step of care coordination is post-acute or long-term care coordination. The post-acute therapies are ideal for the patients from acute care to enhance the seamless transition to home and build their strengths. Some patients may leave the facility fruitful, and some may require additional care programs to gain more power. Kawakowski, 2019. In an effective care approach, accredited care coordinators enhance proper transitions between the clients and the family members to allow all the patients to concur with the same platform with the care plans and the care prospects. Engage the family. It is important to note that some patients may lack family members. Hence, it is essential to include the family members and relatives to ensure adequate care. This is due to the essence that some patients may lack proper communication skills. Miller, 2019. Nurses should ensure that they communicate properly with the patient's family members to enhance appropriate rapport and collaboration to avert other devastating extreme complications and attain proficient health outcomes. Ethical considerations. When regarding the prerequisites of care coordination, the healthcare professionals' codes of ethics are put into account. With proper adherence to the ethical principles, each patient's moral principles, respect, and dynamic needs are respected by the healthcare professionals. Janich and Areola, 2017. Ethics motivate the nurses to exhibit high-level competence and adapt practical strategies, patient values, and health proficiency to augment proper care coordination. Impact of ACA policy on the outcomes and patients' experience. Health education significantly increases good health results. According to the Patient Protection and Affordable Act 2010, Title V, health education involves a patient's ability to obtain, disseminate, synthesize, and comprehend fundamental health data and services to influence appropriate healthcare decisions and choices. Laird, 2020. More often, the primary nurses and bedside nurses can ascertain the patient's potentiality to comprehend their learning mode that would advance proper retention of information to affect people's healthcare results. In summation, joint care coordination is an outstanding factor for the underway and the most effective way to permit patient results. This information will be imperative to be considered by all of you, especially when implementing care planning for the patients. Thank you for listening, and in case you have any questions, do not feel shy to contact me. Is there any questions? Thank you.